Most men don't think about their prostate until it starts causing problems. It's small, hidden, easy to forget. But when it swells, it can change everything: your sleep, your confidence, even your quality of life. Today, we'll uncover the silent signs of an enlarged prostate, medically known as benign prostatic hyperplasia, or BPH, and what your body might be trying to tell you before it's too late. Because the earlier you spot these signs, the easier it is to treat them. The prostate is a walnut-sized gland located just below the bladder. Its main job is to produce the fluid that nourishes and protects sperm. But as men age, especially after the age of 40, this gland can begin to grow. And while that growth is usually non-cancerous, it can press against the urethra, the narrow tube that carries urine from the bladder out of the body. When that happens, you start noticing small, frustrating changes that are easy to ignore but shouldn't be. The first red flag is often frequent urination, especially at night. If you're waking up 2, 3, even 4 times just to pee, your prostate might be the reason. Then comes hesitation. You stand in front of the toilet, but the flow doesn't start right away. Or maybe it starts and stops midstream. You might also feel like your bladder never fully empties. That constant urge, like you have to go again just minutes later, is one of the most common early signs of prostate enlargement. Other subtle signals include a weak urine stream, dribbling at the end of urination, or the need to strain or push just to get the flow started. These symptoms can creep up slowly, over months or years, so many men dismiss them as just getting older. But that's exactly how BPH goes unnoticed. Ignoring prostate symptoms doesn't just affect comfort, it can affect your health. When urine isn't completely released, it can pool in the bladder, creating a breeding ground for bacteria. That means recurrent urinary tract infections. Over time, the bladder muscles can weaken from constant strain, leading to bladder damage. And in severe cases, backflow of urine can even harm your kidneys, something that can become irreversible. It's not just about urination, it's about protecting your entire urinary system. Beyond the physical symptoms, BPH takes a toll on mental health too. Interrupted sleep leads to chronic fatigue. Embarrassment about frequent bathroom trips can cause social withdrawal. Even intimacy can be affected, because the same nerves and blood flow involved in prostate function play a role in sexual health. For many men, it's not just a medical issue, it's a quality of life crisis. But here's something most people don't realize: prostate enlargement doesn't happen overnight. It's a slow, progressive condition, often influenced by hormonal changes, particularly dihydrotestosterone, DHT, a byproduct of testosterone. Over time, DHT causes the prostate cells to multiply, slowly increasing the gland's size. Genetics, obesity, lack of exercise, and even diet can play a role too. That's why regular screening and maintaining a healthy lifestyle become essential after 40. So, when should you take it seriously? If you're noticing nighttime urination more than twice a night, difficulty starting or maintaining flow, pain or burning during urination, or blood in your urine, it's time to see a doctor. Don't wait until the symptoms disrupt your sleep or your daily activities. A simple exam, urine test, or ultrasound can often confirm if it's BPH and rule out more serious issues like prostate cancer. The good news is that modern treatments are far safer and more effective than ever. Treatment depends on the severity of your symptoms. For mild cases, doctors often recommend lifestyle changes, like reducing caffeine and alcohol, avoiding late-night fluids, and exercising regularly. Even small changes like improving posture, staying hydrated during the day, and reducing stress can help reduce pressure on the bladder. There are also medications that can relax prostate muscles or shrink the gland itself. These include alpha blockers that help with urine flow and 5-alpha reductase inhibitors that target hormonal causes of enlargement. And if symptoms are severe, minimally invasive procedures can restore urine flow in as little as a day, no major surgery required. But don't underestimate the power of prevention. Eating foods rich in zinc, lycopene, and omega-3 fatty acids, found in tomatoes, fish, pumpkin seeds, and nuts, can support long-term prostate health. Regular physical activity, especially cardio and pelvic exercises, can also improve blood flow and reduce pressure in the lower abdomen. The truth is, your body is always talking to you. Sometimes, those whispers come from the smallest places, like the prostate. Ignoring the signs won't make them disappear. But understanding them, that's how you take control. So, if you've been waking up too often, struggling to start or stop the flow, or just feel that something isn't right, don't ignore it. Talk to your doctor. Because when it comes to your prostate, early action means lasting comfort. Stay informed, stay healthy. And remember, taking care of yourself is the most masculine thing you can do. If you found this video helpful, hit like, subscribe, and share it with someone who might need this message today. Your health awareness could change